Once upon a time, there lived a jackal and his family in a small town. A jackal and his family loved to sleep outside in the compound on hot nights. One day, a jackal and his oldest son, Kwame, woke up with a fever. They were rushed to a nearby clinic and were diagnosed with malaria.
Oh, poor jackal and Kwame.
Who can tell me why a jackal and Kwame had malaria? Yes?
Because they slept outside without a mosquito net.
Wonderful. And who else?
They did not use mosquito cream.
Mosquito repellent cream.
Good. After the diagnosis, the doctor gave them the ACT prescription and told them to take the medication after meals for 3 days. Kwame took all his medication according to prescription and soon was well. But Ejako, Ejako was the worst patient ever. He didn't want to take his medication and worried his wife and children with unnecessary demands.
Sorry, not for where drone.
Oh, but when you have the also the modern Konokoya one can be mamma the butter down, say.
After taking the ACT medication for 2 days, Ejako felt better, so he stopped taking his medication. His wife insisted that he took all the medication, but he gave all sorts of excuses.
Hey, Mammy Bima. As I make Grammy water, the way me goes one my day. Obia me quiet, Sabia, and me hope put and the mania what he shows any California. When your friends are California,
then something really bad happened. Ejako fell sick again and was rushed to the hospital. He was again diagnosed with malaria, which was even worse. Poor Ejako, he had to sleep in the hospital for 1 week for treatment.
Oh, Ejako.
When he recovered, Ejako vowed never ever to stop taking his medication midway. He even became a volunteer in the community and joined the doctor and the nurses to teach people how to take their medication according to the prescription.
Hey, Dr. Jacko.
Now, I will end my story here today.
Oh, wow.
So that we can have more fun next time.
Yay!
Now tell me, what lessons did we learn from today's story? You.
We should go to the health center or clinic when we suspect we have malaria.
Good. What else? Yes?
We should test for malaria and get our diagnosis before we start taking malaria medicines.
Wonderful. We must get tested in the laboratory, or where this is not available, a rapid diagnostic test can be used. We must also remember to take all our medication according to prescription. Whether we buy the medication from a pharmacy, a chemical shop, or a hospital or a clinic, we must make sure we understand the dosage and take it according to prescription.
Somewhat in your opinion, kind. And Mamma, yes, send your meme ye any be. So we are now quiet, Sabia, said Doctor. Ness or more drop. A drone send your demand. Chill, Numini na cocosi, Nebasa, Binyam Pumutin. Open me dancing. That will come at the actual day. Moncosu, you wish you Martin.
Use ACTs for treatment of simple malaria. ACTs, effective, affordable, accessible. Let's come together and drive malaria away.